Welcome to our 5 on 5. Pleased to be joined today by obstetrician Dr. Linda Harris, part of Clinica's Family and Women's Health Center. Dr. Harris, thanks for being here today. Appreciate it.
Thanks for having me.
Yeah, my pleasure. So you're part of a prenatal care team. Tell us a little bit about the work you do at Clinica.
I work with a group of nurse midwives, certified nurse midwives, who do births at both hospitals, and we take care of a lot of people who have maybe limited incomes or limited resources, but we're really open to seeing anybody for prenatal care.
Okay, and if a woman's thinking about pregnancy, getting pregnant, when's the right time for her to be talking to her healthcare provider about that?
We love long-term planning, planning way ahead. Even if you're perfectly healthy, taking folic acid supplementation for 2 months before you try to get pregnant has been shown to reduce the risk of birth defects and things like schizophrenia and autism. But if you've got medical problems, then more long-term planning helps even more. Like if you have bad teeth, you have to get that mouth fixed before you get pregnant to reduce your risk of a preterm birth. So that takes time.
Even something as simple as that?
Yes, yeah, makes a difference. And if you're overweight or obese, then whatever weight you can manage to lose before pregnancy is going to benefit the baby. That's not fast, right? We all know how hard that is.
Yeah, okay. It's interesting. I did want to ask you about weight gain, diabetes during pregnancy, but what about the future generations and kind of the long-term effects, not just your baby, but perhaps the second generation?
Exactly. It's so interesting that smoking during pregnancy actually affects your grandchildren and their lung size. It causes obesity, and obesity then gets passed on to the next generation when you smoke. And when you're obese during pregnancy and gain more weight, that affects your child's chance of having obesity, heart attacks, strokes, high blood pressure.
Wow, okay. Well, we're going to take a quick commercial break. We'll have much more with Dr. Harris in a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with obstetrician Dr. Linda Harris, and she's from Clinica's Family and Women's Health Center. So we talked a lot about what women can do to plan ahead before getting pregnant. Now, once a woman is pregnant, what are the important things she can do to ensure an excellent pregnancy?
Well, since this is 5 on 5, I tried to think of 5 things.
I love that.
So one is all 3 things that are linked: eating healthfully, limiting weight gain, and exercising. We used to say, it's okay to exercise. Now we want you to exercise. Another is get started on prenatal care. We don't know what's magic about prenatal care, but something is, because people who get prenatal care early have better outcomes. Take that folic acid, prenatal vitamins.
Even before pregnant.
Right.
Like you said, yeah.
That's the most important part. Probably by the time you know you're pregnant, it's almost too late. And then work on stress reduction. That's been shown to help. Even though you can't maybe get rid of stress in your life, learning techniques to help deal with stress is helpful as well. And then the last thing is just avoiding toxins. I threw that all together. That means maybe you're on a medication that you shouldn't take when you're pregnant for a health problem. Get that out of your life and switch to something better. Quit smoking, don't drink alcohol, limit marijuana, avoiding drugs.
Okay, yeah, I wanted to ask you about that. Now it's of course legal here in Oregon for adults 21 and up. A lot of people believe that marijuana isn't as bad as cigarettes. How do you see that as affecting the health of a baby or a pregnant mom? We
do have a lot more information about the terrible things that tobacco does during pregnancy. I could go on for 15 or 20 minutes about that. Marijuana has been harder to study, but I'm convinced that it does affect the baby's higher level brain functioning. They don't do as well in school. They have trouble with long-term planning. So even though they may come out looking normal, I think it can have effects.
Okay, and lastly, do you have any suggestions for women who are thinking about talking to a doctor? What should they look for in a prenatal care provider or clinic?
Well, I am an advocate of midwifery care because I think that it is evidence-based to do things like lower your C-section chance. But I think it's also important to think about what's important to you. Do you want to connect with a person and have that person be the one who delivers your baby? Is it more important that the hospital where you go be able to do a cesarean section very quickly? Who's around who can help take care of that baby after it's born? Who's their team that takes care of newborns? Can they intervene quickly? Yeah. But there is a program at La Clinica that's involved called Centering, which is group prenatal care. And I think that's also something to consider.
Okay, well, very good. Thank you so much for being here and talking to us about it.
Thank you for having me.
Stay with us. We'll be right back.